Alright, everyone. So, this time, I'm going to demonstrate to you a assessment that we can do even with just your senses. Okay? Specifically, your visual sense. Okay? So, what we're going to do is called your postural assessment. So, what is postural assessment? Postural assessment is basically an assessment of the asymmetry of your body. Okay? So, meaning, we have a normal symmetrical arrangement of our bony landmarks and of our bones, of our joints, and of our organs. Now, if there is a problem on a musculoskeletal condition, or if there is weakness on one side of the body, there's a tendency that the posture is also affected. Now, for adolescent, it is common to develop a scoliosis or the lateral curvature of the spine. So, it is commonly present if the patient or the person would have a laterality or lateral difference on the posture or alignment of the spine. Now, what we basically do is just to ask our patient to stand comfortably and in relaxed position. And as PTs, we just try to observe the alignment of specific body landmarks. Now, if I'm doing this position, you could observe my bony landmark or my acromion process here if it is aligned or if one shoulder is actually higher, no? Now, if you will be able to palpate your joints, no, you could place your hand on your waist and then try to check if your waist are level. So you could see if one side is higher or one side is lower. That would mean that if one side is higher or lower, then there's a probability that your spine is curved to one side. Okay? So let me demonstrate and exaggerate an example. Alright? So for example, I am positioned like this. So my shoulders and my hips are not aligned. It's because my spine is curved towards my left. Okay? So that would mean that my right shoulder is higher and my left shoulder is lower. So that would mean that my spine is actually curved like this. So this is what happens for a person with scoliosis. And sometimes there would also be a rotation. So they would be positioned like this. So as the physical therapist, we have to observe the specific alignment during postural assessment so that we could try to provide exercises to correct the posture. In relation to the scoliosis screening that we conduct, we can also perform what we call special tests, no? So yung special tests are some basic tests that we conduct. Just try to observe, no, what are the manifestations of the patient. But then again, the main diagnosis for scoliosis can only be done if there is a presence of an X-ray, because that is the only way that you could see if the spine is not really aligned and if there is really a curvature of the spine. So let me demonstrate what we do for the special test. So for special test, we ask the patient to perform forward bending. So in standing position like this, and then we just ask them to try to reach forward. Okay? Now, upon reaching forward, the physical therapist would observe this region, the thoracic region. Okay? And we'll try to see if one side is higher or lower and if one side has a bump. Okay? Because if there is a bump on one side, that would mean that the convex side of the scoliosis is present on that one. That's why it is curved on that side. Alright? So I will demonstrate first in a normal forward bending, and then I will try to exaggerate for you to observe what I am saying. Okay? Alright? So for example, I would do forward bending. Okay? You just have to ask the patient to try to reach for the toes, but not touch kung hindi kaya, and just make sure that the legs are kept straight. Now, try to observe my back. if there is a curvature. Okay, so now I will try to exaggerate. Okay, so like that. Okay, and try to observe what happens when you try to exaggerate and there is a bump. Okay, so if you could see, there is a higher side on my right, so that means the convex, no? The convex shape of my spine is there. So there's a possibility that I have a right scoliosis, or we call it dextroscoliosis. Okay? So I hope you can somehow try to experience it, okay? And try to observe, no? Just by using your eyes, try to observe the posture of your patient, okay? So that is for assessment, examination, using your vision, okay?